Now we're going to look into the hip area. With the hip, with the coccyx, with the iliosacral joint, with the surrounding muscles, and also the bursas by the trochanters. For me, I use it very often. I use the Skanlab or the Tekar Pulse for pre-treatments for a lot of things in this area. For example, a piriformis syndrome, which can be very tense and is very deeply laying muscle in the bill. It means early days we use the elbow to go down there to kind of friction the muscle and massaging with the elbow. It's really painful. It's difficult for the patient to relax. Then I prefer using the Skanlab to pre-warm the muscle and soften the tissue and detension the tissue there, like a pre-treatment for stretching of the muscle. It's helped really good. I've been working with several ice skaters through the years with this problem. And next to that we have this iliosacral joint problem with women who has becoming symphysis after pregnancy, and they have some really intense pain in the area from the iliosacral joint. This is a really beneficial treatment to treat this area all over the joint, and then you of course do both sides. Next to that you have this bursa on the trochanter. You can also treat that. Sometimes you get really good results and really good response, but bursa is a very known difficult problem sometimes to get rid of, but at least you decrease the pain and you can do some stretching and some exercise to optimize the circulation into the area. And then we have the adductor on the inside of the thighs, which also can be affected due to overstretching muscle strain or something like that in the sport injuries. We're going to look a little bit more into that when we look at the leg later on. But for demonstration now, I would like to demonstrate the treatment of the piriformis muscle. It goes from the trochanter to the iliosacral joint area. And so we're going to treat this area now. And doing that, I very often put some paper on the clothes of the patient so they don't have to get too much cream on their clothes. To protect the clothes a little bit as well. And then I will use the flat rubber electrode underneath his belly now, because like you see I build them up with a pillow so he lays more comfortable and relaxed instead of laying totally flat on the bench. So we put some cream on the electrode, spread it out nicely, and I'm going to work this area, so I put the rest of the cream there. Ask the patient to pick up his belly a little bit and lay down, sir. Thank you. And then we put some lubrication or cream on the treated area. Spread it out with the treatment head before we start the treatment. And then we start pinching the butt. This is one machine that's one of few who can really reach down to the piriformis muscles. So here you really will see that you really get nice quick results by using it. Pinching the hip area. Oh, I pinched the wrong button, sorry. There we have it. And then we pinch the piriformis syndrome and say OK. We get a treatment time of 6 minutes on the top level of intensity. Here we have a really muscle area. You don't work too much close to bone areas, so you will probably be able to stay for a long time on a high level energy. But still you will continuously ask the patient if it's not becoming too warm, then you have to decrease the energy on the treatment head. And we start pinching one of the buttons here, you get the green light on and the treatment is on. You can hold your hand on the patient, or you can choose not to do it, but have a good contact, not only a finger point contact. This will probably take a little bit longer while before he feels the warmth coming up compared to working the wrist or the elbow, because there's too much muscle area in between. So it will take a longer time before he feels the heat coming up. You feel any warmness yet?
Slightly.
Slightly, so like he says, we've been working for half a minute, it's not really warm yet. During the treatment, if you start feeling this becoming too warm, I ask him, is it too warm, sir?
Oh, it's
This
okay.
is okay, but say he says now it's been too warm, I pinch minus 1 step, go down and continue my treatment. Very important doing this is not stopping the treatment head by pinching plus or minus. You have to continue move or take it away. Because if you stop, you get the electrostatic field on the same spot for a longer time, and then it might get warm too quick. So if you're gonna decrease or increase the intensity, take it off and pinch one time and go back on the treatment again. If you're really smooth, you can pinch it while working, but out of experience I see, and I know by myself, that I have a tendency to stop my movement if I pinch it while I'm pinching the minus or plus button. So, and we get the signal when the treatment is finished, we get the signal from the machine saying beep, now we're done. Then we can take the paper we already used to cover his clothes with and dry over the rest of the cream on the area we were treating. So we have a two points benefit of having the paper there. Then I also dry the treatment head and use some disinfection to disinfect the treatment head. Put it back. Next to that, I use water or disinfection to clean the area where we have been treating, just to get the rest of the cream out of the area. And then after doing that, we kind of dry it on the opposite side of the paper, and then the patient is kind of finished with the treatment. Of course, we take away the rubber electrode and clean that area on his front side as well.